Well, good morning, everybody. Mark Rogers here, another retiree health planning strategy session here on a Wednesday morning in October. Welcome. We had a blustering night last night, and I hope you have your coffee ready to go as well, and grab your notepad and such. I do have some good stuff to share this morning, switching it up a little bit here. And I know that some of you are so busy and you're wondering to know, what in the world do I need to do here this annual enrollment period, Medicare's annual enrollment period? And I like to make things real easy. And I'm always thinking about, how do I make things more easy for folks? So I wanted to share with you real quick. For those of you who don't have much time, let's jump right into a process that you can look at here in the coming weeks, okay? So here, I believe, after doing this for 15 years, I believe that everybody should start with their own personal needs first, okay? This is important. You're getting impacted by all the TV ads that are going on, all the mail that you're getting in the thing, all these plans. At the same time, I have to ask, what about you? What about you? What about your prescriptions? You know, what about your pharmacy? What about your doctors and hospitals? Let's be real about this here, folks. With some of these Medicare Advantage plans right now, some are leaving some counties. Okay, there's some, you probably, if you got a letter in the mail from Centers for Medicare Services that it is left your county, that's a big deal. That's a big deal. The other thing is be very cognizant as well of those that are the hospital. If the hospital doesn't take your Medicare Advantage plan, that's a big deal too. So let's start with yourself first. Let's jump into, after you got kind of thinking about yourself first, let's go into the idea of saying, hey, how do we get all your information put into a system whereby it's going to kick out the best solution in the shortest amount of time, okay? So you see this site screaming across the bottom here called comparewithmark.com. Comparewithmark.com. Let's take a peek at that, shall we? And see what that looks like. So let me jump over to my website here. Oh, looks like we just need to do a little quick camera angle shot here. We'll get that going, and then let's take a peek at this website. This Compare with Mark is basically going to show you, it's going to show you how to effectively be able to put in you see your Social Security there? See your Social Security going on there and there? All right, and then you're gonna, and then we're gonna hit the, you can hit the View Plans, right? Hit the View Plans from there, and it's going to go in and start asking questions like, hey, what do you want to look at here? Do you want to look at, January 2024? Sure, that's great. Let me just do that, all right? What zip code are you in? You can put in any zip code you want, and, it's up to you. And then you hit Next, and you say, oh, there's the pharmacy. Isn't that beautiful? Just to see the pharmacy and say, hey, all right, I like the pharmacy here. So enter your pharmacy as you want. I will stop and say on the pharmacy that some of these carriers are putting out some tremendous online pharmacies that you would want to take a look at, and it's important for that. So the pharmacy is next, and then we hit skip, and then we say, all right, I want to add my doctor. This, folks, is a big deal. Putting your doctor's information in here is extremely important if you have a Medicare Advantage plan, okay? Now, I may be talking to folks that have Medicare supplement plans. Hey, listen, welcome to the club. I'm all with you on that. You don't have to worry about doctors. But when you got a Medicare Advantage plan, doctors from year to year is a big deal. All right. And so that's your doctor thing there, and you want to make sure your doctors are there. Now, as I just got done saying, yes, your doctor may be taking it, but the question I'm going to ask you is, what about your hospital? Okay, what about your hospital? Does your hospital take it? Now, here's some people will sit here and go, oh, I called the hospital. No, don't call the hospital. Find out on the system. Find out on this system if your hospital's taken. It'll tell you, but I'm having retirees go, oh, I'm calling down to my hospital. Well, listen, your hospital may give you wrong information. So make sure that you're able to jump on the system here, find out if your hospital is is being taken. All right. So let's go back to, this is the compare with Mark feature here. And then we jump into, after you add your doctor, then we go into adding your prescriptions. Now, folks, as I go into this annual enrollment period, I'm ecstatic about saving people money. I've done it before, and it's just a simple little analysis. It's going to be like right here, where you start putting your prescriptions in, you find out, hey, look at this. I'm on my current card right now, and I'm paying total prescriptions next year, and my card cost, I'm around, $800. But then after you run this thing and you say, well, here's another card cost and total price is like $500 next year. Folks, that's $300. That's a $300 savings. I don't know but there's a lot of people that are in fixed income. Gallon of gas is going up to $5 and plus, and then our income taxes are going up, property taxes are going up. Wouldn't it be nice to save $300 next year? And there's no change in coverage because it's the same drugs, just a different card, different pharmacy, maybe an online pharmacy. So be very cognizant about, this is really where the savings can really come in, okay? And then Medicaid benefits, you say no, or I'm not sure, or whatever. Now this is where by putting your name and your email and your password in here, this is going to be for you. And so if we have a conversation after this, then I can see what you're looking at and we can compare this and go over this together, okay? This is a big deal. I can tell you that, all these regulations coming down the pike, and to have this system up and going now is absolutely, I'm ecstatic to see this, because up until now, I've struggled to help people effectively while staying within the confines of the Medicare rules. And now we can do that. If you put your information on here, we can have that conversation. All right. So far, so good. Let's jump over into the next piece here is step number 3. Step number 3 is where you can schedule 15 minutes with me. Real simple. You can go to that comparewithmark.com/15. All right. Now, Medicare has a rule that says that, by the way, if you're getting phone calls coming in to discuss Medicare, that's illegal. All right. That is flat out illegal. You have got to give your permission to have them call you some way, somehow. Door knocking is illegal as well. And when I say illegal, I'm talking about against compliance. So the way to make things compliance is if you call me, all right? And so if you call me at a set time, then we're going to be compliant in things. It's a recorded phone call. We end up recording it. But the point is, let's talk for 15 minutes. Let's just give it 10 or 15 minutes to find out what your needs are. Based upon that, we can schedule another time, right? At more leisure, we can schedule an hour or whatever, that we can make it leisure. But at this time, why don't you go ahead and just take that, when you go to that comparewithmark.com/15, that'll give you my calendar, set a time slot on there for 15 minutes. It'll give the number on there that's going to be on there. And you call me directly. I'll be waiting for your call. Happy to open up, share the process, because after that is when a scope of appointment goes out to you, and I email that to you or text it to you. That's a scope of appointment. Everybody has to do the scope of appointment to recognize, it's Medicare's rule, to recognize the fact that you have agreed to speak about these things. And if we're going to go in depth on that, we have to wait 48 hours. Okay. So that is that. And then the step number 4 is I do have some upcoming Medicare product sales events coming up here in a little bit as well. And so we're going to be doing that. You can share with your friends, etc., about what these sales events coming up. They're coming. We're still working on them. Okay. All righty. So let's jump over into the agenda real quick here. Now that we got that out of the way. And that was the Cliff Notes. That was the Cliff Notes on, that was the Cliff Notes I did on the Medicare process. I know you've been busy, but what about news that you can use? That's our news segment here, and I think it's important to see that as well. So let's just jump over into the news factor here, and let's take a peek at what is going on here. How about this from AARP, huh? Let's take a peek at this. AARP's weighing in on this. A lot of folks are weighing in on things, and it's always good. I'm always a proponent of being able to say, okay, let's go ahead and share the good stuff here. And AARP's got some good stuff. It's a blog, and the blog was posted just a couple weeks ago. New Medicare Advantage marketing and sales rules will better help protect consumers. And so part of what I had a one of the insurance company's executives I was on the phone with here some weeks ago said, Mark, you got to tell people that these inbound calls that are going on probably are not compliant. And so, and we gotta understand that. Recent evidence indicates a sharp increase in consumer complaints about the marketing and sales of health insurance plans under Medicare Advantage, Medicare's private plan option. This rise in consumer grievances coincides with a soaring enrollment in recent years, resulting in about half the entire Medicare population enrolled in a Medicare Advantage plan. Folks, there's a lot of stuff going on that you got to be aware of. Be very, very careful about who's sitting there calling and discussing this stuff with you, because the complaints are certainly going up. It says the consumer cost of deceptive marketing and sales practice. While Medicare Advantage plans are required to cover the same services as traditional Medicare option, most Medicare Advantage policies offer additional benefits like dental or vision, okay? And people who enroll in Medicare Advantage generally must get care from a provider in their plan's network. And so this is where you're seeing a lot of advertising going on right now. And so there's specific rules that have come out this year. And this is why we're going through this. This year's rules change are the latest in recent efforts by CMS, Centers for Medicare Services, to bolster federal guidelines for how health insurance can communicate about and market their Medicare Advantage plans. And so amongst its key provisions, the latest guidelines make clear that supplemental benefits cannot be advertised in areas where they are available. That's a good thing right there, because I've had in years past, oh, Mark, I want that plan. I'm like, well, that plan is in the county that's like 3 hours north of us here. It's not in this county. That's how it's gone on before. And so looks like they're tightening that down. Require Medicare plans to notify their enrollees each year that they can opt out of phone solicitations to prohibit the use of Medicare's name and logo in a misleading way. Very good. So, this is all about keeping things compliant, protecting the consumer. I get it. At the same time, I will say, by this effort of protecting the consumer, it has also inhibited the ability to provide good, solid information to retirees. And I'm telling you, I've tried my hardest to share, and this is my effort to share that information directly with you via a live stream. And then later on here in another couple weeks, we're going to have live sales events going on with a couple of the big carriers. And I'm also going to be doing a live sales event on non-carriers, those of us that are in rural retirees. These are folks outside of the Medicare Advantage plans. And so out in the Pacific Northwest, there's a lot of country land out there in Oregon, Washington, Idaho, etc. We're going to do a specific webinar series for rural retirees. And so I wanted to make sure that you're apprised of that. Okay. All righty. Well, let's do the fun game here. It's called Spin the Wheel. So let's spin the wheel here, and let's pop that back up here. There's the wheel spinning. There is lots of topics there. If you got a question, by the way, if you're online and you want a question, you want to pop a question in, feel free to pop a question in as well. But we got our topics on various things, and so I'm going to attempt to answer it here in a second. So let's go ahead and give the wheel a spin. Part B with pitfalls. Part B with pitfalls. There we go. There's a good topic right there. So let's, this is, there's been a lot of people that have gotten surprised. They have gotten surprised on things. And so I'm anxious to share with you about how some of these surprises are happening. All right, so let's do this. Let's do the whiteboard. Here we go. All righty. Okay, so the topic is part B with surprises. Okay, here we go. So let's talk about Part B first of all right? So Part B basically says that it's an outpatient situation, right? Outpatient. If you're taking notes, don't copy my handwriting. That's just trying to do what best I can do here. Outpatient, right? So this is going to be doctors. It's going to be therapies, right? Therapies. It's going to be testings. All right. So there we go. Doctors, therapies, testings, even outpatient surgeries, right? So outpatient surgeries will fall in here as well. All righty. So that's the outpatient stuff. On Medicare Part B, you currently pay a premium, right? So you have a premium, and your premium is going to be determined by how much you are making in retirement. Some people make a lot, so therefore Medicare says we're going to go ahead and raise your premium price, okay? So I don't know, it might be a 150, 140, whatever you are, it's 140, 150, you might be 200, 250 based upon your income. And then you're going to have a deductible. So let's pop open a deductible here. And so let's get ourselves some blue here. And so the deductible once per year, $220 or so, all right? Basically, you're going to pay that starting once in the year when you see your first doctor visit, okay? All righty, so let's move forward here. And then Medicare, this is the catch on the whole thing here. Medicare pays 80%, and you're on the hook for 20%. So this is going to be the pitfall right here, all right? That's going to be the pitfall going along the way. So we're going to go ahead and dress this up a little bit. So how could you be impacted here moving forward with this? Well, if you have a cancer treatment, an outpatient cancer treatment, this is where it's going to be 20% of the bill, right? If you have a cancer treatment there or an outpatient surgery, as we just talked about, outpatient surgery, or you are in the hospital, and we talked about this on yesterday's thing, but you're under observation. Okay, you're under observation. So there, they got you in the hospital there somewhere along the way. They have not technically admitted you, and in technically not admitting you, you are under observation, and you're not falling under Part B. All right. And so here's the catch on this. So where the pitfalls happen is this very thing of, let's go ahead and put this in blue. And so obviously if you're in a med sup plan, you should be pretty golden. You should be fit to go. I mean, the outpatient cancer, it's going to plug probably, if you got a decent med sup plan, it's going to take care of that 20% we talked about, right? So that 20% is taken care of, should be good to go on that. Outpatient surgery, again, it's going to pick up that 20%. Hospitalization under observation, pick up that 20% on an outpatient basis. All right. But what if you're on a Med Advantage plan? Okay. If you're in a Med Advantage plan, then all the rules associated with outpatient is going to come into perspective here for your copays and things like that. And look for your true out of pocket. So you're going to see that term out of pocket. Check for that term out of pocket, by the way, and see exactly what that out of pocket is in a situation like that. But what if you're under straight Medicare, or better known as original Medicare, and you only have Part B? And there are a fair amount of people that are still running around. I think it's like 20, 25%, maybe 30% of the retirees still only have original Medicare only, right? And so you have nothing to back you up. And so that's where you're going to be on the hook for 20% of the bill. What does that 20% result? Well, if one of these deals is going on here, I happen to know that, a same-day cancer treatment may be $20K for the week, right? If you're $20K for the week, that's a lot. That's $2,000 that you got for that week in an outpatient basis, right? So, or no, actually $4,000. So the point is you got to be very, very careful about if you're under straight Medicare as to how much you're going to be exposed for under straight Medicare. Also, how much you're going to be exposed for the when you're under a Medicare Advantage plan. Like I said, the Med Sup plan, you should be pretty solid with that, and that's why Med Sup plans take away a lot of the surprises. So that's our spin the wheel. We did the part B with surprises, and there are surprises that, you know, people don't like surprises in retirement. That's what I have found. People just don't like surprises. I don't either, but it's even more tough when you're got surprises and you're on a fixed income and you weren't expecting that, and that is a big problem. All right. All righty. Well, what else we got here? So that's going to be right about it. You can go to Medicare with Mark, jump over there if you want. You know, you can do the scope of appointment if you want. You can jump over there and do the scope of appointment along the way. Of course, you can't see me there. That's all. That's too bad. Let's just roll this up here, and let's get you. Oh, there we go. And then after that, we're going to have some sales events coming up here. So I look forward to seeing everybody here. We'll do one more stream tomorrow, and we'll be updating the website as we go along here. I want to make sure that the website is getting up. A lot of things are going on behind the scenes, by the way, here. A lot of changes. And so there'll be links. You can drop in along the way with links and enter your information. We'll hope to see everybody again tomorrow morning, or if not, drop it in the chat as to how to set up that 15-minute appointment. You got that figured out? Stream it across the bottom, and we'll do that. Compare with Mark. All right, compare with Mark, and that'll get you into the process. All right, we'll catch you soon. Have a good day. Have a great day. A really good day.